Well, here is your host.
And we welcome you to this edition of Public Report. We're delighted to have Dr. Cabeza with us, and he is an internal specialist. Welcome to our program, and glad to have you with us today, man.
Thank you very much.
I need to know all the things I can do to stay healthy and keep living for a long, long time.
Okay.
What is internal medicine, and why did you get into this information or area of specialty?
Well, internal medicine is a specialty in the medicine that deals with medicine for adults. It's not a surgical specialty, but deals with all, the patient as a whole with different diseases, ranging from acute diseases to chronic diseases, like diabetes, hypertension, heart disease, stomach problems, and also acute problems like infections and things like that.
Okay, with people my age and above, maybe, there's a lot of things that goes wrong with our body that perhaps could be preventable if we would just take a little more effort in making a healthy lifestyle or do things better to make us healthy. What are some of these things?
Well, that's a very good question. There are many things that we can do, and actually that's what I recommend to my patients. There are simple things like, eating healthy and trying to lose weight, exercise. The people that quit smoking, that smoke, of course, is very important to quit smoking. And we also recommend to visit your doctor at least once a year. If you don't have any chronic diseases and you think you don't have a need to see your doctor, we recommend them, at least an annual physical once a year, because you can find things that you cannot feel. Like, for instance, your blood pressure could be high and you don't feel anything, because blood pressure doesn't cause any pain, doesn't make you bleed. So you think, well, nothing's going wrong. But if you go and your blood pressure is high, that can be treated, and you can prevent a lot of complications for that. The same thing, diabetes. For instance, in general, when a patient is being diagnosed with diabetes, the statistics say that he has been diabetic for 5 years before he realized that he's diabetic. So complications could be already occurring in their bodies.
Okay, at what age should we, as adults, start doing that yearly visit?
Well, we see patients 17, 18 and older, and when they're with the pediatrician, they normally get checkups very frequently. So we encourage people starting from 18 years old.
Okay, so it's not 40 or 50 or on up
No.
there like some doctors recommend.
Because there are things that can be done before the time, that are important for them, and they're, sometimes if there's a heavy family history of certain diseases, there are things that can be done. Unfortunately, obesity is being more and more prevalent or more frequent in younger people. So you can start working at a younger age on those issues.
And you said diet was very important. What are some diet type things that people need to do?
Well, things that are very important is to decrease, fatty foods, very refined sugar foods. And basically, one of the main things I tell my patients is portion control. They're not bad foods in general, is sometimes the amount, So that's a very important thing. Now, depending on what you find in the patient, you can tell some of them that they need special diets. If they have cholesterol issues, if they have hypertension issues, we will advise them to decrease salt. And there are other diseases more specific in which, in those cases, maybe you want to avoid certain foods.
Okay. Vaccines we hear a lot about, especially the flu vaccine. And are there other vaccines that we as adults ought to be taking, or are there some?
Absolutely. Absolutely. For instance, people don't realize that tetanus vaccine or tetanus shot is still important. Each of us needs a boost every 10 years. So that should be done, frequently. There is a vaccine called Pneumovax or pneumonia vaccine that is highly recommended for people over 65. And if you have chronic diseases that can affect your immune system, those patients should get the pneumonia vaccine, pneumococcal pneumonia vaccine earlier. Like, for instance, if you have asthma, if you're a smoker, if you're diabetic, if you have any other disease that can decrease your immunity, those patients should get that vaccine earlier. There is another vaccine that has been approved recently for people over 60. It's a shingles vaccine. It's very important. We know that shingles is more frequent as you get older because your immunity decreases. Most of the people already have the virus in them, and it gets reactivated late in life and can give you shingles. So if you're over 60, you need to talk to your doctor and maybe get that vaccine. And of course, you know, there are other vaccines that could be done dependently, you know, in your interest, but hepatitis B is a big one too. So,
well, as a church, we have a flu vaccine clinic every year for our people and for others outside the church. But there's some people who say that they are fine, feel healthy, and then they get the flu shot and they get the flu.
Well, you know, it used to be that the case. Years ago, the flu vaccine used to be something we call a live attenuated virus. Basically, the virus was not completely killed. And some people will get sick after the vaccine, 3 days of fever, you know, muscle aches. Nowadays is a dead virus, so you shouldn't have that problems. You know, like I tell my patients in our office, everyone got the flu vaccine and no one got sick. You can get cold, you can get other viruses, but not the flu.
Okay. Well, I knew, you know, a lot of times people complain about they do get sick after the vaccine,
Yeah.
and I've heard some doctors say, well, that's because they were already taking the flu or
I
something
think
like
that's
that.
a misconception. People think that the flu vaccine is going to protect them against any viral disease. That's not the case. It's just against the flu this year. It's against H1N1, or you know, the one that we were concerned last year, and the regular virus A and B, influenza A and B this year. And if you get the vaccine, you should be protected 95, 99% against the flu. You still can get other viruses, you know, like a bad cold or something like that, but not the influenza.
Okay, and you know, the vaccines we take, they really do prevent us from having a lot of problems as adults.
Exactly. Especially like the ones that I mentioned. I like the one for the shingles, I think is very important, and the one for the pneumococcal pneumonia.
Okay, great. Let me ask you a question. A lot of emphasis is placed now on colonoscopies.
Mm-hmm.
I think everyone dreads that more so than they should. You know, the first time I went, I thought, oh my Lord, you know, this is going to be rough. And actually, I laid there and watched them do it, and some people they put to sleep. I didn't go to sleep.
Really?
And the doctor said, hey, you're good for 3 years. No use to come back.
Okay.
But it is important, very, very important, because as a pastor over the years, I've dealt with a lot of people that have colon cancer, and that can be detected at a very early age.
Listen, I'm very passionate about that because my mom died of colon cancer when she was 58, and that could have been prevented. Colonoscopy is highly recommended over 50 because 90% of the colon cancer happens after you're 50. Now, what I've talked to my patients, and I found out that many of them are scared more of the preparation than the procedure, because now the procedure, they can put you to sleep and you don't feel anything. The good thing with colonoscopy is just for you to know, there are other things that you can do to either prevent or detect cancer earlier. But the best one is colonoscopy. And colonoscopy not only can detect the colon cancer early, but also if you find polyps or any lesion that is precancerous and you take it out, you are preventing cancer. So that's the beauty about colonoscopies.
I personally think everyone ought to have one, because I do, get tired of going to see people who have colon cancer and knowing that this certainly could have been prevented if they would have done what you're saying. And that's so important with people, because we are creatures of habit. We put off things and say, well, I feel healthy, I don't, And of course, I have a great doctor that I go to, and he's always amazed at how healthy I am for my size. And he says, well, I thought your cholesterol would be high. I thought this would be high. I said, you're better shape than I am.
Well, you have good genes, probably.
I do have good genes, that's for sure. Okay, what are some of the lifestyles that we can, changes we can make to improve our longevity of our life?
I think, as we talked at the beginning, quitting smoking for the people that smoke is very, very important. Trying to stay healthier with a good nutrition, and exercising is very important. If you exercise and lose weight, your blood pressure is going to normalize. If you, nowadays I see a lot of people that either are overweight or obese that have what we call pre-diabetes. And if those patients are able to exercise, at least walking 30 minutes 5 times a week, because that's been studied already, and losing weight, they can either prevent the development of diabetes or delay it as much as possible. The later you get diabetes, the better, because the less complications you're going to have, because less exposure to high sugars in your blood, which causes, the damage. So those two things, along with, quitting smoking and seeing your physician at least once a year, are very important steps to stay healthier and prevent further problems.
Okay, can you give us some information now on how to get in touch with you or with your group? And
yes, I work for Cornerstone at Premier, and our phone number is 336-802-2075, and the website is www.cornerstonehealth.com, so they can get in touch with me there.
And you're open to questions, your staff is open to questions, and to make appointments for people
Sure.
to come in and get some
Sure.
help.
Sure.
And that's very important in these days, that we do stay healthy because of the fact of our longer living, longer life than we used to have. It used to be 47, now it's probably close to 80 by now. And thank God it is that age.
Yes, we need to take advantage of the knowledge we have nowadays, and all the science behind it. We are not perfect. We don't have sometimes the answers to all questions, but I think we have made a huge progress.
Maybe our last question should be, it seems to me that the health profession now is shifting from just treating symptoms to helping people not have diseases.
Yes, we're trying to shift to that area because we know that if we can prevent, that is only beneficial for the patient's health, but also for your pocket. You can prevent serious diseases in the future and huge expenses as well.
And that's very important in these days, society and all like that. I want to thank you for coming in, because I think your information should help a lot of people.
You're welcome.
That are dealing with the things that we deal with, and especially at my age. I'm 65, heading down the hill now, and I look forward to that. We'll be right back. Stay tuned. We look forward to seeing you in just a few minutes. Be right back after this message.